So let's talk about MRSA. We see it out in the clinical settings, and it's something as nurses that we really need to understand. So MRSA is methicillin-resistant Staphylococcus aureus. That's why we call it MRSA. Looking at MRSA, just so you know, it is a part of our normal flora. It's on our skin and our mucous membranes. So it's something that's on us, but we can get to a point where we have this methicillin resistant. It's resistant against certain antibiotics if it becomes an infection. So MRSA most often causes skin infections, but it can cause lung and other infections. It can cause a MRSA pneumonia. And so just so you know, don't think it's just something on their skin. It's not. It can be found anywhere that staph enters. So we hear a lot about MRSA infections or staph infections post-op. If they've had surgery, those things that can happen. So it's just something to be aware of. And if left untreated, MRSA infections become severe, and these patients can become septic and die. So it isn't something to just think less of or like it's not that important. It is. We see a lot of patients that are MRSA positive. There are a lot of patients and people out there that carry staph or MRSA. It's colonized in their nares, in their nose. Nurses are one of those folks. So used to what they would do is test us, swab our nose, and if we tested positive, it was colonized, they would make us go home for 7 days, and we would have to take Neosporin and swab our nose every day, twice a day, putting Neosporin up in our nose, killing it. They stopped doing that because so many nurses had it colonized. We had absolutely no nurses to work. So it became an issue. So then they started just saying, hey, by the way, just know a lot of you guys have colonized staph, MRSA, and so please, just swab every so often. And so what we would do is just on our own every so often just go through a period of time of swabbing ourselves to kill it. Kind of interesting fact, I think. So causes neutropenia or neutrophil dysfunction. Um, if we have any kind of neutrophils are what we need to fight off infection. And so if we have any of those disease processes or anything that affects the neutrophils, we can be actually very open or receptive to get MRSA. Diabetes, once again, you can't live anything without it being present. It's non-healing wounds from diabetic patients may predispose them to MRSA. So they're the ones that have poor circulation. The microcirculation is damaged due to diabetes, the vascular piece, neuropathy. They don't feel their injury. They get wounds. The blood sugars are uncontrolled, so the blood is sugary, and so things don't want to heal properly, right? Things are just in disarray when it comes to diabetes. Well, unfortunately, they have a lot of wounds that don't heal, and we are the ones in the hospitals and clinic settings that see those wounds. And so they are very predisposed to getting MRSA because we know that staph lives outside of the body. They can get a staph infection and then it can become a MRSA or a methicillin resistant. So it's something to be very aware of. And that's why it's so important that we teach diabetic patients to take care of themselves, to wear socks with their shoes, to wear proper fitting shoes, not walk on the beach barefooted where they cut their feet with sand or shells. All of that. Take a mirror and put it on the floor and put your foot over the top and look at your bottom of your feet. Check in between your toes. Make sure we don't have those injuries or wounds. IV drug users or IV drug abuse. These people inject drugs and they're most likely to develop a serious staph infection. They're the ones that can get MRSA. They also are ones that can have a lot of horrible infection and that can go to the heart. They're shooting and injecting directly into a vein, which is into the circulatory system. And what happens is they're introducing what's on the outside of the body. They can have dirty needles, that the body itself, they're pushing that into that system. And they're the ones, they're very they're highly at risk of getting MRSA. Foreign bodies, prosthetic devices put in, prosthetic joints, heart valves, vascular shunts, grafts, catheters, and even IVs. So we need to remember that and make sure that we really wash our hands, really clean the area with a hexadine swabs before we insert an IV. Make sure we keep very clean as we do this so that we don't introduce anything directly into the circulatory system. And then, of course, trauma. Anytime you have an open wound of any form, and when we think trauma, we think, oh, bad trauma, bad trauma. But no, I'm talking about just generalized trauma. If you're walking out to your car and fall and skin your knee or skin the whole side of your leg or something, it's a traumatic injury. It's considered a fall, ground level fall, but you can have now an open wound that could be predisposed to getting a MRSA infection. So you want to be very careful. So any of these patients, if there's a disease process or anything like that, we see a lot of people with diabetes. We need to be aware. We put IVs in all of our patients. We need to make sure that we're clean and use proper technique. Signs and symptoms. Well, with skin infections, any skin infection, we're going to see swelling, warmth at the site, redness at the site, pain at the infected site. They're going to have pain where it's located. These are things that we'll see with other infections also, so it's not as easy to say this is MRSA or not. But if it is a skin infection, we will see this. If it's MRSA, we will see this also. But blood and deep tissues, anything else internal, we can have a fever of 100.4 degrees Fahrenheit or higher. They're going to run a fever. Chills, and that might be a little different in some of your books or readings, but just remember this, they're going to have a fever that's greater than 100. Chills, malaise, dizziness, confusion, muscle pain, swelling and tenderness in the infected body part. So if it's a joint, if you think about it, chest pain, cough, inability to heal wounds. So if it's resistant against something that's going to kill infection, the infection's going to keep coming, right? We're going to keep having these issues. Wounds don't heal. We've got to give them things that will kill it, and there are some medications out there that do work. Just a few of the drugs. For my students, you don't need to know these drugs. I just wanted to familiarize you with them because clindamycin is one, tetracyclines is one, and then of course the last one, and I never say it correctly, but I think it's linezolid. They're ones that we can use. These are some of the medications that will kill MRSA. What are nursing goals? We want to ensure isolation and contact transmission precautions. So they need to be in their own room. They cannot share a room with others. It's spread through contact. So we want to make sure anybody coming to visit puts a gown on, puts gloves on, so they're not touching anything where they can pick it up and then give it to themselves or others. So we want to make sure that we have that. Make sure you identify your patient if they're on any isolation outside of the door and have the proper things ready for them to put on before they enter the room. But before they enter the room, they need to understand they're going to take it off before they exit. They'll get to the doorway. There's usually a line that they will see lines, in the rooms. When you get to a certain point, you take everything off, put it down, and step outside. Wash your hands and then step outside. That's why sinks are right there. We want to wash before we go in and wash before we leave. Encourage strict hand hygiene. Strict hand hygiene to me is make sure you're washing with soap and water, and we want to encourage that. Yes, gel in between. You can use hand gels to kill things, definitely by all means, but we want to make sure they wash with soap and water. Strict enforcement of personal protective equipment, PPE, put those gowns and gloves on. Now, if they have a lung infection, MRSA lung infection, they have pneumonia, MRSA pneumonia, you want to then probably wear a mask because, yes, when they cough, laugh, sing, anything like that, they can spew out the droplets that are infected and they can land on you or you could inhale. So we definitely might put a mask on for that, including eye protectant at this point. Ensure a clean environment. Make sure the trash gets thrown out. If they're going home with MRSA, You want to make sure that they're washing the bedding on a regular basis, things like that, keeping things, towels, bedding, all of that clean. And make sure if they're using tissues, anything like that, um, or are they any kind of bandages or something, if it's a wound and they're having to change the dressing at home, that it's, put into something, tied down, and definitely disposed appropriately. And prevent the spread of infection. We don't need to, that's why they need to wash their hands and protect themselves. We don't want to spread it. That's why we use our PPE. That's why we put them on isolation. If they're going home, teaching the family and friends what they need to do to protect themselves and to also protect the patient, because we need to get them better. Whenever you have an infection, you are now considered compromised. So, with an infection, your immune system is compromised. You are compromised and you need to get well, or you can become even more sick. And we don't want that. And once again, it's almost a repetition, but these are nursing interventions. Ensure isolation and contact transmission precautions. What do you do? A sign should be outside of the door. Anybody entering should be able to read and understand that they are on isolation. You want to make sure everybody's performing proper hand hygiene, including yourself. Use your PPEs, which are gown and gloves, unless there is droplet issues where they're coughing, or if it's in the lungs somewhere. But if it's in a wound and you're worried that the wound's going to splash up while you're changing a dressing or doing something, then you would want to increase your protection by putting on a mask and eye protectant. But normally the main thing is gown and gloves, because it's contact isolation. Decontaminate the patient's equipment. We try to use throwaway stuff with anybody in isolation. So everything goes to be burned. It would go into the red bag so that it can go and be processed and burned, and not just thrown out there into the environment. We also want to clean with a bleach solution. They get cleaned properly, the whole room, floor included. So that if anywhere the contact the bed, make sure your bed is good and clean. A lot of people want to lean up against those guardrails or the side rails, and they want to touch the table a lot. Well, those are two big places. Those side rails in the bed and their bedside table are huge areas of things that collect. It's dirty, guys. Just remember that. So if you go in there and you're all leaned up against it and you don't have a gown on, you're probably getting and in contact with this bacteria, and then this can create and cause spread, and we don't want that. And monitor for signs of infection. Go back, fever, chills, um, all of those things that are listed on the other slide, those are signs. Also, looking at labs, if you have an increased white blood cell count, that is a sign there's an infection present. So we look at that. If we have a fever, what happens to the rest of our vital signs? Normally, we become tachycardic. We can we can be tachypnic, increase our respirations if we have an infection. Just those things can happen with the fever alone. So looking at that and understanding, we are looking at infection and what can happen. So once again, what isolation should you use if they have MRSA? Contact, gloves, and gown. But if it's MRSA pneumonia, a mask should be worn and it becomes a droplet precaution situation. So I want you to understand that. For my students, they really need to understand isolations. This is important for not only the patient safety, but for your safety. After COVID and everything that's gone on, we really want to be careful and protect ourselves, plus the patients, plus the families and others. And so if they don't know, they don't know. So it's very, very important. Kind of interesting, this little note for others is that the hospital we're at, they put it on this computerized board, very small. It's right on the outside. It doesn't just grab your attention like the big bright signs that we used to post outside the door. So make sure that in report, if you're getting report from another nurse, to ask, are they on any isolations? Is there anything going on that I should know about? Because you should be aware of it before you walk into that door, because you never want to expose yourself or anybody else. Or take anything home to your loved ones. That's another. So this actually comes from I have it cited at the very end of these, but what I did is I brought these over for you to read through and understand. This is contact isolation. If they have an infection with an organism transmitted fecal orally, such as C. diff, wound or skin infections, or multi-drug resistant bacteria, such as MRSA, excuse me, is contact precautions. PPE defined by the CDC is entering contact precaution is gloves and gown, but a mask and eye protection are additionally required if contact with bodily secretions as possible. Meaning, if you can get splashed, if you're emptying a drain and there's a ton and you squeeze one of those bulb drains, protect yourself, guys. Think about this. You don't want that to spew all up on your face, into your mouth, into your eyes, or into your nose. So you want to be very careful. So the other thing I want to talk about is bloodborne precautions. It's time for you to understand this. You're in the clinical setting. One of the things, if any disease process that can be spread through blood, like HIV, Hep B, C, malaria, measles, herpes, any bacterial infections, any other ones that you know of that can be transmitted through blood-containing fluids or products, you need to use bloodborne precautions. Bloodborne precautions include wearing gloves, face masks, protective eye wear, goggles if needed, and proper handling of sharp objects with appropriate disposal. So you can also add gown to that if you're worried about splashing or anything like that. But if you were going to, let's say, stick an IV, then you would want to put on, you'd want a mask and eyewear to protect yourself, or if you were cleaning out a wound or something. Anytime you're worried about being splashed or contaminated, put on a mask and eye protection. It's very, very important. Also, sharps, don't ever recap a dirty needle. Don't ever, 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 ever recap a dirty needle. Engage your safety, and if you do not have a safety on that needle, then you need to hold it above waist height, above your waist, and you need to announce that you have a sharp. I've got a needle going to the sharps container. I've got a needle. So you don't want anybody to run up on you so they accidentally stick them with a dirty needle, or you don't want it so close to your body that if you turn or hit something, it sticks you with a dirty needle. So you want to be very, very, very careful with that. Using bloodborne precautions includes cerebral spinal fluid, pericardial fluid, pleural fluid, and peritoneal fluid. So if you're doing dealing with any of those fluids, you need to use bloodborne precautions because that they have whatever and can spread those disease processes and bacteria through that fluid. Sputum, vomit, sweat, feces, and nasal secretions, they don't require bloodborne precautions unless you visibly can see blood. Lots of times you'll have GI bleeders, and we know if it's coming up and out, if it's an upper GI bleed, it can be a brighter blood. They're throwing up more bright blood, but sometimes it's been processed. It's lower, and that means they could throw up coffee ground looking emesis. Same with their fecal matter. It doesn't always come out looking melanin, it's not that purpley, bloody look to it, but it could even be a very dark black stool because it's gone through the digestive tract. And by the way, blood never is digested in the digestive tract. That's why we throw up what we throw up, and that's why we actually stool what we stool when we have a blood bleeding issue with the GI system. If you do ever get exposed, make sure you wash immediately the affected area with soap and water, and you want to immediately let your charge nurse know or your supervisor, and that you need to follow the bloodborne infection and immunization status of yourself and your patient, and follow the protocol. So you want to wash immediately with soap and water, let someone know that you've been exposed, and then most of the time you have to report to the ER if you're in a hospital, and then you'll go from there. Also, too, you want to make sure that you understand, talk to your patient. You want to know, are they IV drug users? You want to know, have they had a history of any of these diseases that could be possibly spread through your exposure? So keep yourself safe with this. So looking at droplet precautions, we know to stand 3 to 6 feet from our patient. These are patients that are usually infected with influenza. They can transmit through the air by coughing, sneezing, talking, close contact with an infected patient's breathing. Don't let them breathe on you when you're doing your assessment. Patients should be placed in individualized rooms. Of course, they need to be in their own room. You need to make sure that they have the proper isolation tagged outside the door and all the product that's needed before anybody enters into the room and understands what's going on. In addition to standard precautions with this, you add a surgical mask always before entering, and then take it off and leave it behind as exiting. You don't want to bring the germs outside to others, but you also don't want to go in to this room because you can inhale and get this infection. So we want to keep you safe. So airborne precautions, we all know this. We've dealt with this with COVID. We are Airborne precautions are required whenever entering a patient's room that's been possibly exposed to anthrax, TB, measles, chickenpox, and other things. And COVID should be added into this. It's standard precautions, wearing gloves and a gown, and also you need additional PPE and N95 respirator mask properly fitted. That's why we're all fitted when we start working or we go for our clinical settings, so that we have the proper fit of the mask so that we're not being exposed to any of these airborne diseases. Also, used to, we would use the mask, and at the end of the day, the mask would be thrown away and put back. We only used it for 24 hours. Now with COVID being here, we have learned that we don't do that. We can reuse clean masks, all that good stuff. Still be very, very careful and understand that you want to do your hospital protocol for these disease processes. Use the precautions that the hospital says to use, or the clinical setting. Make sure family or anybody entering understands what's going on. If they have any compromised immunity themselves, they don't need to come in and expose these patients, or be exposed by these patients. And they also, if they have any illness or sickness, do not need to bring it to these patients, any of them. So we want to make sure that we explain that, especially with someone from the outside coming into someone very sick like this that could be compromised by their disease process. So BRE is vancomycin resistant enterococci. This is another resistant bacteria that will cause an infection that's very difficult to cure. It's resistant to penicillin, gentamicin, and vancomycin. Those are big boys. Gentamicin and vancomycin are big boy antibiotics, and this is very resistant to it. For my students, just FYI, I've added a PDF for you to read through. It's for your understanding and protection. Testing purposes, you'll see nothing on VRE this semester, but I do want you to read through to protect you in the clinical setting. I hope this helps.